Hi, Mr. Chen.
Hey doc.
What brings you in today?
Yeah, my feet hurts.
Can you point to the spot where it hurts the most?
It hurts right around here.
When did you notice it?
Well, I've noticed it since about last week. On the day that my left leg started hurting, my leg kind of just gave out that day, and then my leg swelled up at night for some reason. I have no idea what's going on with me. Can you please help me?
Have you been doing anything differently?
I don't notice doing anything differently. I've been just walking around doing what I always do. I have been watching my grandkids recently.
What specifically did you do with your grandkids?
We were just biking around, me and my grandkids just biking around.
On a pain scale of 1 to 10, 1 being the least pain, 10 being the most pain, what would you rate your pain right now?
I would rate my pain a 3 out of 10 right now.
Are you currently taking any medications for the pain that you're having?
No, I'm not taking any medications right now.
Are there any things that you're doing currently that helps with the pain?
Yeah, I've been putting ice patches and wrappings around my foot because, it's just the swelling. I want to keep it down.
Now, Mr. Chen, to summarize and to make sure that I have all the information gathered correctly, what you're here for today is that you're having foot pain, specifically on the left ankle. You have noticed this pain since last week when you were playing with your grandkids, and specifically when you were biking with your grandkids. You haven't been taking any medications, but you have been putting on wraps to help reduce the edema at night on your ankle. And you're here today because you want to find out why your ankle is hurting you so much and what could be the cause of this concern. Alright everyone, I hope you guys enjoyed that skit. If you did, please give me a like and you can subscribe so you can see more next time. So the general rule is that for every patient that comes in, you want to know exactly why they're coming in for. So there are certain mnemonics that you can use, like SOAP note. S stands for subjective, so whatever the patient says. This would include things like the chief complaint, which is the skit that I just did. It also includes like medical history, surgical history, family history, social history, all that stuff. Anything that the patient says, right? Everything that's being said in the patient's words. And through the subjective and the objective, what we're trying to do is find a story for this patient and help them solve what they're coming in for. The patient that I had, Mr. Chen, he's having a left ankle pain, right? We want to know what caused it. From my questioning, I was able to get it down to a point sometime last week where he was riding a bike with his grandkids. That was probably the onset that triggered his left ankle pain. So let's just try to establish that as a student, for every patient, you want to do the SOAP note, right? So again, this S stands for subjective. You should include this mnemonic called NALDOCAT. So the N stands for the nature, which could be, on my patient, Mr. Chen, he had lateral ankle pain. So that's the N, right? L stands for location. Well, it's on the left foot, lateral ankle. D stands for the duration. So how long has it been? For Mr. Chen, it's been a week. O stands for the onset. Did it come on suddenly, or for Mr. Chen, it was that night after he was riding bikes with his grandkids. And C stands for the characteristic. So what kind of pain is this? Is it a throbbing pain? Is it a radiating pain? Well, for Mr. Chen, I didn't ask that question. I just knew that he experienced some pain, maybe tenderness on the lateral side. Maybe I should have asked, right? C stands for any aggravating factors. For Mr. Chen, it hurts him more when he's walking. Due to some kind of deformity on his left ankle, this damage caused him to have pain when he's walking more, all right? And lastly, is there any, the T stands for treatment, right? And although CAT. T stands for any treatment. Has Mr. Chen been taking any medications? Has he been doing anything that helped with his pain? Well, he said he's only been wrapping his foot at night to keep the swelling down. And other than that, he's not been taking any medications. So once that's done, you're done with the NLDO CAT, right? So you're trying to create a story, a chronological story. When did it happen? How did it happen? What was he doing when it happened? Has he been doing anything to make it feel better? One tip of advice is that you always want to repeat everything that the patient said so that they can either confirm or deny or maybe change some things that maybe they didn't meant to say. So that's a good strategy. And then you'll go on to take their medical history, their surgical history, their medications, their list of medications if they're a new patient. That's also part of the subjective. After subjective is done, we move on to the objective, which is everything that I do. So objective, you can use the mnemonic VOND. So each of these is crucial to your physical examination of the patient. So V stands for the vascular. You want to check their vascular status by checking their pulses, their capillary refills, etc. For the O, it stands for orthopedic. So you want to check their musculoskeletal stuff. So for example, and it really depends because the physical exams that you do, there's so much things you can do, but because Mr. Chen, he was only coming in with an ankle problem, I'm not gonna check his hallux, right? So that wouldn't make sense. I would just check his ankle rotation, see at what point does it hurt, and you would also check that on the contralateral side, meaning that you want to check his right foot as well, the one that's normal. So you get to see, okay, at this point it hurts on the left foot, but on the right foot it's completely fine. So there must be something wrong when he does the rotation, something like that. And so we got to the V, vascular, we got to the orthopedics. Okay, now we move on to N, neurology. You want to check if his sensations are still intact. And lastly, D stands for dermatology, nails and skin. For Mr. Chen, you could have checked whether in the area was he swelling, was there pitting edema at the site, was there any bruise marks at the site? And yeah, those are the physical examinations. And after you're done with the objective, this is when you gather all the information, all the chief complaints, all the medical history, all the surgical history, etc., and also your physical exam that you just did on the patient. This is when you report back to your attending. You tell your attending, so Mr. Chen last week, he started experiencing this left lateral ankle pain, and he was playing with his grandkids. They were biking, His pulses are 2 out of 4, After you report all that, your attending's gonna say, okay, let's go see your patient. And then you'll go see your patient. And then your clinician will most likely, if everything you've done up to this point has been on point, and your clinician can pretty much diagnose the patient right there and then and say, so this is what's wrong with you. So for my particular patient, if any of you were paying attention, he was biking, right? And this is probably the only activity that he's strenuously doing with his grandkids, right? And on the area that he pinpointed earlier, he said, this is where I'm having pain. Specifically, he was having pain at the ATFL, which is anterior tibial fibular ligament. And that area, when my clinician pushed onto it, he said, yeah, this is where I'm having pain the most. It is most likely that he has maybe a sprain of his ATFL. In the end, I think my clinician prescribed him a boot or some sort, and then have him check back with within a couple weeks. Yeah, so that's essentially the rundown of how clinic life has been. Pretty much I'm just taking history, going through the Inaldo CAT, getting patients, medical history, surgical history, blah, 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 and then doing my own physical exam, and specifically doing the exams that I think will help me solve the problem, and then reporting back to my attending, and then my attending will go to the patient and diagnose him, and then give him a treatment. So I hope this has been educational. Please give me a like, and you can subscribe so you can see more next time. There, vitals.